Hello students, today we will discuss most important MCQ and its detailed explanation with basic concept. These are most important for exam point of view. Question: which drugs cause osteoporosis on long term use? Options are estrogen, progesterone, gonadotropin releasing hormone analogs, warfarin. Answer is gonadotropin releasing hormone analogs. Gonadotropin releasing hormone analogs analogs are synthetic version of hormone gonadotropin releasing hormone produced by hypothalamus. Gonadotropin releasing hormone analogs can cause bone loss and increase the risk of osteoporosis, especially in men with prostate cancer. GnRH analogs are specially used for prostate cancer in men. It can cause a decrease in bone mineral density, which can lead to osteoporosis. In cause bone loss at the spine, hip and femur. Another important question is glucocorticoids on long term use can cause osteoporosis. Most important and most repeated question, glucocorticoids on long term use can cause osteoporosis. Next question, during normal course of breathing, the volume which is received by the lungs is known as, options are TB, tidal volume, residual volume, IRV, inspiratory reserve volume, ERV, expiratory reserve volume. Answer is A, TB, tidal volume. Tidal volume is during normal course of breathing, the volume which is received by the lungs is called tidal volume. Residual volume is the volume of air remaining in the lungs, remaining in the lungs after maximum forceful expiration. Remaining in the lungs after maximum expiration is called residual volume. IRV, inspiratory reserve volume, is the amount of air that can be inhaled after a normal breath with maximum effort. After normal breath with maximum effort. Expiratory volume is the amount of air that can be forcefully exhaled. It is inhaled and it is exhaled after a normal breath. Most important terms. Next question, life of RBC red blood cell present in human blood is, options are 30 days, 90 days, 120 days, 150 days. Answer is C, 120 days. Lifespan of RBC is 120 days. Next question, what is the percentage of water in urine of a normal adult? Options are 60%, 100%, 95%, 55%. Answer is C, 95%. Urine primarily made up of water 95% and others waste materials 5%. These are urea 2%, creatinine 0.1%, potassium 0.6%, chloride 0.6%, uric acid 0.3%, and other pigments, hormones, metabolites and amino acids in small portion in urine. Most important. Next question, as per the Drugs and Cosmetic Act, chemist and druggist means premises for sale of drug which have, options are qualified person and drugs are compounded, qualified person but drugs are not compounded, compounding facilities but qualified person is not needed, any experience holding person who can formulate composition. Answer is B, qualified person but drugs are not compounded. As per Drug and Cosmetic Act, now what is chemist and druggist, what is pharmacy? Let's see, drugstore is no qualified person engaged, but retailing of drug is there with some restriction. What is chemist and druggist? Chemist and druggist is qualified person is engaged but only for dispense, not compound, only for dispense. What is pharmacy? Pharmacy is qualified person is there, mean that a pharmacist is there and is qualified for compounding and also for dispensing. Very important things and also for new things. Next question, the usual source of heparin is, options are blood, fish, tissue of domestic mammals, plants. Answer is C, tissue of domestic mammals. Most commercial heparin is obtained from cow lungs and pig intestine. Next question, which vitamin is used occasionally as an antioxidant? Options are vitamin D, vitamin K, vitamin B1, vitamin E. Answer is vitamin E. Vitamin E is a natural antioxidant. And vitamin C also a water soluble antioxidant. Next question, confidentiality has been amended in which section of MTP Act? Options are section 4E, section 5A, section 2D, section 6. Answer is B, section 5A. Section 5A of MTP Act says no registered medical practitioner shall reveal the name and other particulars of a woman whose pregnancy has been terminated under this act, except to the person authorized by any law or time being in force. Any RMP can disclose the termination of this lady at any condition. Question, blood group B person can receive blood from persons of blood group. Options are AB blood group, B alone, A, B and O and B. Answer is D, O and B. Blood group B person can receive blood from O and B. Similarly, A positive person can receive from blood A positive, A negative, O positive, O negative. A negative person can receive A negative, O negative. B positive person can receive B positive, B negative, O positive, O negative. Similarly, B negative person can receive B negative, O negative. AB positive person receive any blood group compatible with all blood types. Universal receiver है ना AB positive. Next, AB negative can receive AB negative, A negative, B negative, O negative. O positive can receive O positive, O negative. O negative person only receive O negative blood. Very important things you have to remember. Next question, betadine contains, options are 5% of available iodine complex form, 10% of available iodine complex form, 7.5% of available iodine complex form, 2% of available iodine complex form. Answer is A, 5% of available iodine complex form. 5% of betadine is used for antiseptic and disinfectant agent. 10% of available iodine complex is a povidone iodine solution. 7.5% of available iodine complex is surgical scrub. Dosage of drug is determined by the following except options are volume of distribution, half-life, lipid solubility, excretion of drug. Answer is C, lipid solubility. Volume of distribution, half-life, excretion of drug is for determined of dosage of drug. Next question, question number 12. Under Drugs and Cosmetic Act, Schedule FF contains the list of following. Options are drugs which can be marketed under generic name, drugs which are habit forming, standards for ophthalmic preparation, drugs which are exempt from certain provisions applicable to manufacturing. Answer is C, standard for ophthalmic preparation. Drug which can be marketed under generic name is Schedule W, drug which are habit forming is Schedule X, drug which are exempt from certain provisions applicable to manufacturing Schedule K. Infected blood products may produce serum hepatitis due to presence of, options are hepatitis A, hepatitis B, hepatitis C? None. Answer is B, hepatitis B. Serum hepatitis is also called hepatitis B. These are viral hepatitis. Viral hepatitis are hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Hepatitis A, C, D, E are contain RNA virus. Hepatitis B contain DNA virus. Most important things, A, C, D, E contain RNA virus, B contain only DNA virus. Most important for exam point of view. Next, hepatitis A and hepatitis E. Most common is transmitted by food, water, oral route and fecal route. Hepatitis A mostly commonly affect children and hepatitis E affect slightly elder or adolescents. These are hepatitis A and hepatitis E are acute hepatitis. Next, hepatitis B and hepatitis C is most important. Hepatitis B contaminated by saliva, body fluid, blood-borne, sex, vaginal fluid, or most important is needle stick. It also contaminated by needle stick injury. Hepatitis C also contaminated by blood, body fluid, sex, childbirth, blood transfusion. Hepatitis B and C also contaminated blood transfusion. These are called chronic infection or chronic hepatitis. Last, hepatitis D. Hepatitis D is contaminated by blood serum, blood-borne, body fluid. Very interesting thing is, if a person affected with hepatitis D, that means the person is already infected with hepatitis B. That next question, insulin usually classifies as protein, hormone, enzyme, amino acid. Answer is B, hormone. Insulin is a anti-diabetic or hypoglycemic agent. Next question, question number 15. Rotosort is used for, options are sorting filled capsule, filling the capsule, mixing of powder, none. Answer is A, sorting the filled capsules. Filling of pellets in capsule is done by rotofill. Filling of liquid in capsule is by qualisil. Next question, pregnant women usually become deficient of, options are iron and sodium, sodium and calcium, calcium and iron, magnesium and iron. Answer is C, calcium and iron. Next question, oral contraceptive exert their effect primarily, options are preventing fertilization of egg, suppressing ovulation, inactivating sperm, preventing menses. Answer is B, suppressing ovulation. Next question, question number 18. The major contributory to the blood supply of liver is, options are hepatic artery, hepatic vein, portal vein, none. Answer is C, portal vein. The portal vein or hepatic portal vein is a blood vessel that carries blood from the GIT, gallbladder, pancreas and spleen to the liver. Hepatic artery and hepatic vein. Hepatic artery and hepatic vein are blood vessels that supply and drain blood from the liver. Most important, hepatic artery, hepatic vein. Portal vein is most important for exam point of view. Next question, insulin injection comes under the schedule. Options are S, P, G, A. Answer is C, G. G is drug medical supervision drugs, under medical supervision drugs. Schedule S, standard for cosmetics, P for life period of drugs, A for performa per application. The apex of heart is formed by, options are left ventricle, right atrium, left atrium. Answer is A, left ventricle. Apex means top or highest part. If this is heart, right atrium, right ventricle, left atrium, left ventricle, this is the highest part. This is the apex part of the heart. This detailed explanation of these 20 questions are most important for exam point of view. Thank you.